NCLEX-RN Practice Exam number 17. Question 1. A nurse is working in an outpatient orthopedic clinic. During the patient's history, the patient reports, "I tore 3 of my 4 rotator cuff muscles in the past. Which of the following muscles cannot be considered as possibly being torn? A. Teres minor. B. Teres major. C. Supraspinatus. D. Infraspinatus. Answer: B. Teres minor, infraspinatus, supraspinatus, and subscapularis make up the rotator cuff. Question 2. A nurse at outpatient clinic is returning phone calls that have been made to the clinic. Which of the following calls should have the highest priority for medical intervention? A. A home health patient reports, "I am starting to have breakdown of my heels." B. A patient that received an upper extremity cast yesterday reports, "I can't feel my fingers in my right hand today." C. A young female reports, "I think I sprained my ankle about 2 weeks ago." D. A middle-aged patient reports, "My knee is still hurting from the TKR." Answer: B. The patient experiencing neurovascular changes should have the highest priority. Pain following a TKR is normal, and breakdown over the heels is a gradual process. Moreover, a subacute ankle sprain is almost never a medical emergency. Question 3. A nurse working a surgical unit notices a patient is experiencing sob, calf pain, and warmth over the posterior calf. All of these may indicate which of the following medical conditions? A. Patient may have a DVT. B. Patient may be exhibiting signs of dermatitis. C. Patient may be in the late phases of CHF. D. Patient may be experiencing anxiety after surgery. Answer: all of these factors indicate a DVT. Question 4. A nurse is performing a screening on a patient that has been casted recently on the left lower extremity. Which of the following statements should the nurse be most concerned about? A. The patient reports, "I didn't keep my extremity elevated like the doctor asked me to." B. The patient reports, "I have been having pain in my left calf." C. The patient reports, "My left leg has really been itching." D. The patient reports, "The arthritis in my wrists is flaring up when I put weight on my crutches." Answer: B. Pain may be indicating neurovascular complication. Question 5. A 93-year-old female with a history of Alzheimer's disease gets admitted to an Alzheimer's unit. The patient has exhibited signs of increased confusion and limited stability with gait. Moreover, the patient is refusing to use a WC. Which of the following is the most appropriate course of action for the nurse? A. Recommend the patient remain in her room at all times. B. Recommend family members bring pictures to the patient's room. C. Recommend a speech therapy consult to the doctor. D. Recommend the patient attempt to walk pushing the WC for safety. Answer: B. Stimulation in the form of pictures may decrease signs of confusion. Question 6. A nurse is covering a pediatric unit and is responsible for a 15-year-old male patient on the floor. The mother of the child states, "I think my son is sexually interested in girls." The most appropriate course of action of the nurse is to respond by stating, A. I will talk to the doctor about it. B. Has this been going on for a while? C. How do you know this? D. Teenagers often exhibit signs of sexual interest in females. Answer D. Adolescents exhibiting signs of sexual development and interest are normal. Question 7. A high school nurse observes a 14-year-old female rubbing her scalp excessively in the gym. The most appropriate course of action for the nurse to do is A. Request a private evaluation of the female's scalp from her parents. B. Contact the female's parents about your observations. C. Observe the hairline and scalp for possible signs of lice. D. Contact the student's physician. Answer C. Observation of the student's hair is the next step. Question 8. A nurse is caring for a patient who has recently been diagnosed with fibromyalgia and COPD. Which of the following tasks should the nurse delegate to a nursing assistant? A. Transferring the patient to the shower. B. Ambulating the patient for the first time. C. Taking the patient's breath sounds. D. Educating the patient on monitoring fatigue. Answer. A nursing assistant should be competent on all transfers. Question 9. A nurse has been instructed to place and foreline in a patient that has active TB and HIV. The nurse should wear which of the following safety equipment? A. Sterile gloves, mask, and goggles. B. Surgical cap, gloves, mask, and proper shoewear. C. Double gloves, gown, and mask. D. Goggles, mask, gloves, and gown. Answer D. All protective measures must be worn. It is not required to double glove. Question 10. A nurse is instructing a person who had a left CV and right lower extremity hemiparesis to use a quad cane. Which of the following is the most appropriate gait sequence? A. Place the cane in the patient's left upper extremity, encourage gain, then right lower extremity, then left upper extremity gait sequence. B. Place the cane in the patient's left upper extremity, encourage gain, then left lower extremity, then right upper extremity gait sequence. C. Place the cane in the patient's right upper extremity, encourage gain, then right lower extremity, then left upper extremity gait sequence. D. Place the cane in the patient's right upper extremity, encourage gain, then left lower extremity, then right upper extremity gait sequence. Answer. The cane should be placed in the patient's strong upper extremity, and left arm, right foot go together, for normal gait. Question 11. A nurse has just started on the 7 p.m. surgical unit shift. Which of the following patients should the nurse check on first? A. A 75-year-old female who is scheduled for an EGD in 10 hours. B. A 34-year-old male who is complaining of low back pain following back surgery and has an onset of urinary incontinence in the last hour. C. A 21-year-old male who had a lower extremity BKA yesterday, following MV and has phantom pain. D. A 27-year-old female who has received 1.5 units of RBCs via transfusion the previous day. Answer B. The new onset of urinary incontinence may require additional medical assessment, and the physician needs to be notified. Question 12. A 64-year-old Alzheimer's patient has exhibited excessive cognitive decline resulting in harmful behaviors. The physician orders restraints to be placed on the patient. Which of the following is the appropriate procedure? A. Secure restraints to the bed rails on all extremities. B. Notify the physician that restraints have been placed properly. C. Communicate with the patient and family the need for restraints. D. Position the head of the bed at a 45-degree angle. Answer C. Both the family and the patient should have the need for restraints explained to them. Question 13. A 22-year-old patient in a mental health lockdown unit under suicide watch appears happy about being discharged. Which of the following is probably happening? A. The patient is excited about being around family again. B. The patient's suicide plan has probably progressed. C. The patient's plans for the future have been clarified. D. The patient's mood is improving. Answer B. The suicide plan may have been decided. Question 14. A patient that has delivered a 8.2 pounds baby boy 3 days ago via C-section reports white patches on her breast that aren't going away. Which of the following medications may be necessary? A. Nystatin. B. Atropine. C. Amoxil. D. Loritab. Answer. A thrush may be occurring and the patient may need nystatin. Question 15. A 13-year-old girl is admitted to the ER with lower right abdominal discomfort. The admitting nursing should take which the following measures first? A. Administer Loritab to the patient for pain relief. B. Place the patient in right side lying position for pressure relief. C. Start a central line. D. Provide pain reduction techniques without administering medication. Answer D. Do not administer pain medication or start a central line without MD orders. Question 16. A 64-year-old male who has been diagnosed with COPD and CHF exhibits an increase in total body weight of 10 pounds over the last few days. The nurse should A. Contact the patient's physician immediately. B. Check the intake and output on the patient's flow sheet. C. Encourage the patient to ambulate to reduce lower extremity edema. D. Check the patient's vitals every 2 hours. Answer B. Check the intake and output prior to making any decisions about patient care. Question 17. A 32-year-old male with a complaint of dizziness has an order for morphine via 4. The nurse should do which of the following first? A. Check the patient's chest X-ray results. B. Retake vitals, including blood pressure. C. Perform a neurological screen on the patient. D. Request the physician on call assess the patient. Answer. B. Dizziness can be a sign of hypertension that may be a contraindication with morphine. Question 18. A patient that has TB can be taken off restrictions after which of the following parameters have been met? A. Negative culture results. B. After 30 days of isolation. C. Normal body temperature for 48 hours. D. Non-productive cough for 72 hours. Answer. A negative culture results would indicate absence of infection. Question 19. A nurse teaching a patient with COPD pulmonary exercises should do which of the following? A. Teach pursed-lip breathing techniques. B. Encourage repetitive heavy lifting exercises that will increase strength. C. Limit exercises based on respiratory acidosis. D. Take breaks every 10-20 minutes with exercises. Answer. A pursed-lip breathing will help decrease the volume of air expelled by increased bronchial airways. Question 20. A patient asks a nurse the following question. Exposure to TB can be identified best with which of the following procedures? Which of the following tests is the most definitive of TB? A. Chest X-ray. B. Mantoux test. C. Breath sounds examination. D. Sputum culture for gram-negative bacteria. Answer. B. The Mantoux is the most accurate test to determine the presence of TB.
Thanks for watching. Please comment, like and share.